As soon as the public health emergency was declared, there was, the public health had their own operations center, and we had our joint information center kind of working side by side. As soon as the county declared a local, basically emergency, and then we carried on to a local emergency, our Office of Emergency Services kicked in action. Office of Emergency Services is a office under the Office of the Sheriff, and our goal is to help manage emergencies, all these local emergencies. And we're a part of the standardized emergency management system here in the state and the national incident management system through the federal government. And it's a way for us to manage emergencies on a federal, state, and local level. The idea here is that when a major disaster occurs, major emergency like this occurs, is that we need additional resources, and we need to funnel all those resources and tracks properly through the county. So my job through the Office of Emergency Services is to put a staff together to properly do that. And so what we've done is we have about 60 people now that are working in our Office of Emergency Services at our Emergency Operations Center that are tasked with that very job, is to support this emergency, this public health emergency. So this thing that we've wanted to stand up, which is the alternate care site, we needed to add beds and our bed capacity to our hospitals. Essentially, hospitals did what they could. They staffed as they could rearrange their hospital setting to push as many beds as possible inside their facility, but we're still short. So we had to create an alternate care site. Our EOC kicked into action, and we were working with Cal OES, and we brought together essentially a 100-bed alternate care site that they can use, that as people are starting getting well out of the hospital, they can go and use this if we're in a place where we need it. Now the state roadmap says we need to put this in place in order to loosen up our restrictions, and so that's one of the steps that the EOC used. So that's just one of the many factors. There's other things that we're doing to support the emergency. One, financially. So we're tracking all the expenses to make sure that the county and the cities don't become bankrupt over this, because there's a lot of federal funding and state funding that can be used to reimburse our response costs. And so that is one of the key factors, our finance section here, to make sure that things are tracked so that counties and the cities can get reimbursed up to 93% for certain purchases, including costs for staffing. So all these things, is a cost, as well as small business. Small businesses, a business in general, is a part of our Emergency Operations Center for the outreach for small businesses and to lend support for small businesses. And so there's a lot of different things we're doing there. Planning, operations, logistics, all those things are funneled through the EOC. And then and any request that we can't fill within the county, we would push that request to the state level. And the state then pushes it to the county. And then if it's a city request, we push it down to the cities. So it is a major operation, as well as our Joint Information Center is utilized. Right now we have close to 25 or 30 personnel assigned to our Joint Information Center, and it's filled with the most talented people in the county. These people are there to utilize all the latest information from the public health officer, from Cal OES, from the federal level, and push out information to the public from a credible source. And this is the information that I'm using. This is the information that the public health officer is using to make, the most reasonable decisions based upon all the circumstances. And so we're doing that right now. And so we're really, really, we take this serious, and we're living by this information that we're receiving and pushing it out. And then so, if anything, I think we're oversharing information, but people have to go where the information is. So the information that our wonderful JIC team has put together is all at humboldtgov.org, okay? And it's our main county webpage, and the main webpage is dedicated to our COVID response. And so that's where you're going to get the latest information. We have Facebook, we're on radio, we're on TV, we're in print, print media. So we're trying to get the word out as much as we can, and we'll continue to do so. But we urge people to validate the information. I know people are shopping around as much as they can to try and validate information from one way or another. There's a lot of opinions out there about how things should be doing and should be going. But at the end of the day, it's like, I have to live by the decisions, okay? Dr. Frankovich has to live by those decisions here. If we screw up and things are not right, then we're responsible for those decisions. If someone else's decision to make it in here for Humboldt County, they have no culpability. But we have culpability here, and we take this job very, very serious, and we're doing our best to make sure that our community is safe. That's our number one priority, is that our community is safe, and that we will open things up when we have permission from the state, and that we will, be utilizing a lot of the information we've received here in the county and from the cities to make sure we're making the right steps in our next phase.